Hello everyone, welcome back to my channel. Myself Dainy Thomas, working in AIMS Delhi. Today we'll be discussing few objective questions. First question, lactated ringer solution is contraindicated in. The options are hypovolemia, burns, lactic acidosis, fluid loss as bile, or diarrhea. Okay, so in these options, which is the condition in which RL is contraindicated? You should know what is the content of RL before marking it. Okay, so RL is also known as Hartmann solution, and it is contraindicated where the administration of sodium, potassium, calcium, lactate or chloride could be clinically detrimental. Okay, lactate administration is also contraindicated in severe metabolic acidosis or alkalosis and in severe liver disease or anoxic states. Okay, which affect the lactate metabolism. So in this, the option is C. Second question, ECG changes in myocardial infarction is. So a ECG strip is given here. So what are the ECG changes in myocardial infarction? Options are ST elevation, wide QRS complex, presence of a U wave, prolonged PR interval. So we can say that ST elevation is the main ECG change that we see in myocardial infarction. Okay, in ST elevation MI, ST segment elevation is seen, as well as we can also see T wave inversion or T depression. Okay, T inversion. So in this ECG, you can see in which one leads the ST is elevated in V1, V2, V3, V4 and V5 have a little bit of elevation. Okay, so we can say that the patient may be having extensive anterior wall MI. Okay, and the artery which is involved can be left main coronary artery. Okay, because that is supplying the anterior portion of the heart. Also, we can see T inversion in these ECG strips. Okay. So moving to, so the answer is A. Third question, which of the following is not required for clot formation? So the options are vitamin K, calcium, plasmin and fibrinogen. So the answer is C, plasmin. Other components are used for clot formation. They are involved in the clotting mechanism. Fourth question, a menstrual condition characterized by severe and frequent menstrual cramps and pain associated with menstruation. Okay, so here they are asking about severe and frequent menstrual cramps and pain. So the options are dysmenorrhea, amenorrhea, hypermenorrhea and polymenorrhea. So among these, the option right option is dysmenorrhea, A. Fifth question, which precaution is used during the phototherapy? So you can have an image based question from the same question also. You can see the image in Norcet 2021. You can expect these type of questions. Okay, they can show the image of the phototherapy unit and ask what is this machine, like that they can ask. Okay, so which precaution is used for phototherapy? Options are leave infant's clothes on, check the infant's temperature once a day, reposition the infant frequently and cover the infant's eyes. So the most appropriate option from this is cover the infant's eyes, D. Sixth question. A 4-year-old female child vomited and her mother stated she vomited 200 ml of the formula feeding in this morning. What type of data is this? So the options are objective data from a secondary source, objective data from a primary source, subjective data from a secondary source, subjective data from a primary source. So before answering this, we should know what is subjective data and objective data. So subjective data, that is the information that we collect from the client itself or one's own view. Okay. So those are their feelings or perceptions or any concerns that we get. Okay. For example, pain. The patient will say, I am having pain. So that is a subjective data. And objective data, they are observable, what we see in the patient. And they are measurable, or they are also known as signs. And subjective data, they are symptoms. Okay. So objective data, for example, we can say the blood pressure of the patient or the sounds that we hear. Okay, so these are the objective data. So what are the sources of data? There are primary and secondary sources of data. So the primary source is the person who is examined, the person itself. Okay, and the secondary sources, any family members or any significant others like parents or wife or husband or those who are with the patient. Okay. Also, we can have the health professionals or medical records. Medical records are also secondary source of data. Okay. The conferences, rounds, consultations, these are also included in the secondary source. The results of diagnostic tests or any relevant literature or another a senior nurse's knowledge and experience. These are all included in secondary source of data. So in this question, they have asked the mother is telling about her child. So that is a objective data from a secondary source, right? So the right option is A. Last question. The nurse chose to assess an apical pulse instead of a radial pulse. Which of the following condition of the client influenced the nurse's decision? Okay. So the options are client had surgery 18 hours before, the client has an arrhythmia, the client is in shock, and the client's response to orthostatic changes. So the right option is option number B. In this picture, you can see the nurse is placing her hand in the chest of the patient. So where is the apical pulse felt? That is felt at the apex of the heart. So that is in the mid-clavicular line that is drawn from the middle of the clavicle and at the fifth intercostal space. In the imaginary line drawn from the mid-clavicular line, from the mid-clavicle to the fifth intercostal space, that area is known as the area where the point of maximal impulse of we can feel the apical pulse. Okay. So in case of arrhythmia, we can feel the we'll try to feel the apical pulse rather than the radial pulse. Okay. So these are the questions for the day. Hope you have got it, and thanks for watching my channel. Please subscribe and share to your friends for more questions and videos. Thank you.